Centre for Inquiry, Canada's premier venue for secular humanists, atheists, skeptics, and free thinkers.
Scott is a practicing pharmacist in Ontario, works in the Ontario cancer system. He's also founder of the Science-Based Pharmacy blog, is one of the contributors to the Skeptic North blog, and has just started contributing to the Science-Based Medicine blog. He's actually a one-man CAS. He's been writing very informative pieces on alternative medicine. I know when I got started in this, I really didn't know much about alternative medicine, and one of the major resources I go to is Scott's work. So very happy to welcome Scott Gavura, who's going to be talking to us about alternative medicine and pseudoscience. Scott?
Thank you. Thanks for the opportunity to speak to you tonight. So tonight I thought I'd speak to you a little bit about alternative medicine and pseudoscience, and I want to tie that into how we make healthcare decisions in general and what I think we should be doing about it. But I have to admit, right now I don't have all the answers. So I'm hoping that you're going to have some for me, because some of the challenges that we face in healthcare are fairly substantial, and they don't have easy solutions. So I'm looking for advice, as well as as well as your input into and your participation in some of the work that's done around ways that we can improve the way that we use medications. So we start off just by way of a little bit more of my background. I'm a pharmacist by background. I've been working in pharmacy for about 15 years, and started working at the individual level, working in a pharmacy, then working in a hospital. So working to improve drug use at the hospital level, and subsequently went into government and in the cancer agencies to actually making changes at the population level, and that's kind of where my interest is, because I'm going to come back to that point about the different areas where we can affect change. So we'll start with just what I want to talk to you, really, to put this in perspective, is just to look where we humans have been. And we don't have to go very far back. This chart here from 1979 looks at our life expectancy. Really in large part due to modern medicine, our health has really never been better. And it's actually quite remarkable how much better our health is. And this is, when we look at how well a population is doing in terms of health, we generally look at fairly aggregate values. So we'll typically look at 1 year life expectancy at birth, and then we'll also look at mortality statistics as well. So if we look back, life expectancy at birth is now close to 80 years. But we can go back even further. We go back into the 20s, and we can see that life expectancy back in the 20s was under 60 years of age. And keep in mind that in this area between it wasn't really, modern antibiotics really weren't used until about 1932. That was when the first antibiotic really came into widespread commercial use. Before that time, if you got an infection, there really wasn't a whole lot you could do about treating infections. You would pour different types of acid, and you would and there would be bleedings, there would be different types of treatments. But just basic infections, skin cuts and wounds, that we can now be treated very easily. None of that existed at that time. At the same time, we've had dramatic improvements in other areas of our health, particularly in public health. So in addition to antibiotics, the vaccinations, and certainly the better maternal and obstetrical care as well. And in general, the non-health drivers in terms of our improvements of health would be things like safer workplaces, motor vehicle safety. If you're interested in the evolution of healthcare as it applies to drugs, there's a really good book I'll recommend called The Demon Under the Microscope. It's an excellent book that talks about antibiotic development, and recommend it highly. So this is a slide, and I pulled this from Eric Davis and other Skeptic North contributors' blog post, which just got picked up by the National Post today, if you didn't see it. And it was about an article in the Star on the weekend called, Eric called his post, "Who's Killing Our Babies?" And really a very poor treatment by the Globe with respect to some statistics around infant mortality. And if we look at infant mortality from the 20s until now, in the 20s, infant mortality was 1 in 10 in the first year, and now we're down to 5 in 1,000. So it's a remarkable improvement. So I'm going to make some assumptions around my audience here. My guess is that you're probably pretty interested in health issues. You're probably pretty interested in science. You look at a chart like this, and this is a chart showing all the ways that a cancer cell can be stimulated to grow. And like, I find it really amazing that when we started to treat cancer we were using things like nitrogen, mustard gas, because that was the only thing that was a very crude tool to treat cancer cells, because it killed every cell. So we try to use it selectively to kill the cells that we wanted to target with respect to cancer. And now we're at the point where we can prospectively design agents to actually interface with the specific tumor markers on the tumor cell. And it's amazing. It really is quite remarkable, the amount of specificity that we have in terms of drug design. And like that's the type of stuff that really fascinates me, and the integration of how we can use science in a prospective way to actually design treatments for therapies is what I find really fascinating in my current role in cancer treatment. But I think what we're seeing more and more, and what concerns me, and I hope it concerns you too, is that we're seeing a wider embrace of pseudoscience within the healthcare system. So you may be noticing parents who are refusing routine vaccinations for their children. It could be the unquestioning acceptance of alternative healthcare providers into hospitals, or you might be puzzled why federal or provincial levels of government have taken an interest in alternative health, but instead of eliminating it, they've actually been enabling it. And what's consistent with all of these events is really kind of a departure from what we would say is evidence-based, science-based decision-making into changes that have resulted in health decisions that are inappropriate, wasteful, and in sometimes even dangerous. So you look at this bottle of snake oil from the turn of the century. There's products that really aren't that different that you'll find on pharmacy shelves today. They're not called snake oil, but as someone says about homeopathy, at least snake oil had the decency to contain some snake. So I think, so in a healthcare system, particularly when we're in a universal coverage system, we should expect that healthcare decisions made by governments should be made on the best scientific evidence, and we should also expect that individuals, when given with rational information, will make decisions that are logical and based on the best possible evidence as well. Because if we don't use scientific evidence as a basis for our health decisions, what are we going to use? So this is just a hierarchy of evidence that we use in terms of evaluating different types of clinical evidence. And what you don't really see here is anecdotal evidence, ideas and editorials and opinions, but we hope that in general those are usually based on scientific evidence. But in general, the randomized controlled trial is really the top. The systematic reviews and meta-analysis are really the ultimate in terms of what we're using to make decisions. So I think that what we have is we have a chasm in place to some extent between alternative medicine and pseudoscience and the desire for people to use evidence-based medicine. And so I guess the question is, can we bridge that? And I think that there's three things that I want to point out that I think we need to keep in mind when we're talking about alternative medicine and pseudoscience. And the first is that health is different than decision-making around other interventions. The second one is that pseudoscience can be pretty hard to spot when we're talking about healthcare. And the third one is that we need to interface at three different levels when we're talking about making changes and improvements to the way that we use healthcare and the way that we make decisions around healthcare. So let's start with talking about how health is different. And I think that pseudoscience, when we talk about pseudoscience and health, it's different. Like, health is a state of being, but it's also something that we need to work at to achieve. And the way the World Health Organization defines health is it's a state of physical, mental, social well-being. It's not really truly the absence of illness, but health is really something that's been, the argument or the term of what defines health has been argued for many times. And I think in general what defines health is really accepted to fall into four different categories. So there's human biology, there's environment, there's your lifestyle, and then there's your access to healthcare services. So all four of those can drive health. So let's start with a decision on how we acquire healthcare. So we really don't buy health like we acquire other things. So, and health is big business. I mean, 10% of our total economic spending in Canada is spent on health. But let's look at how we would compare health to compare how we'd buy a flat screen TV. So if you're in the market to go buy a flat screen TV, you might get consumers reports, you'll do some research, you'll look at your budget, you'll make an evaluation based on what factors are important to you and what aspects of the TV that you want to buy, and then you'll make a decision and you'll buy it. You're going to cover the cost because you're paying for it. But compare this to health spending. In general with health, we don't have a good idea of knowing exactly what we want. You generally need someone to tell you what it is. Generally with health, you can't shop around. You get what's given to you, and you don't generally care with health about the price, because in most cases, we're lucky in Canada that those prices you're not paying for it. You don't think about the cost at all. So there's a number of factors that influence, from an economic perspective and from a decision-making perspective, how we make our decisions around health will differ. So there's the moral hazard of the fact that you're not covering the cost. There is the fact that the supply and demand are really limited by factors that you're not controlling. In a public healthcare system, generally the people who need healthcare the most are the ones who are least able to access it. and so there are a number of restrictions that are placed on the way that you access healthcare, from the way that the access to becoming a health professional is capped. Your access to different healthcare is capped in the way that there are wait lists in different parts of the healthcare system. And this is counterbalanced by the fact that government has a very large role in the way our healthcare system is administered. And so I'll come back to that as we talk about the way that alternative medicines and pseudoscience are used. And so in general, it's really hard to evaluate risk and benefit when we're talking about healthcare. So let's say you've got a 5-year-old child, and your child's got a cough and can't sleep at night, so you want to go and buy a cough medication. So you go into the pharmacy and you don't think too much about it. I want to get a cough medicine for my child, so you go to buy a cough syrup, and the pharmacist says, oh, well, they're not used anymore. We don't use cough syrups in children anymore. And you might ask the pharmacist, well, why not? I've been buying cough syrup for years. I drank Dimetap out of the bottle when I was a kid, and now you're telling me I can't use it anymore. And we'll say, well, yeah, we found out by looking at data that's emerged that cough syrups really don't work in children. They don't really provide any benefit, and in some children, in some very rare circumstances, there's actually harms that are possible. And so, on balance, when there's no evidence of benefit and there's a possible risk of harm, we make a decision, or in this case, the regulators have made a decision to restrict access to those therapies and tell you that you shouldn't be using them in children. So compare this to pseudoscience, and this is almost without exception. When you're looking at alternative health, it's positioned as black and white. It's either good or it's evil. Usually evil is anything that's made by a pharmaceutical company, and usually anything good that is something that's labeled as natural. And this is where I find dealing with a lot of the alternative medicines very frustrating, is because what we're often dealing with is an absence of data. We don't have any information upon which we can evaluate whether a therapy is good or bad. And so when you're speaking to a health professional, you'll usually get an equivocal response, like to say, well, we just don't have any information to say whether it's good or bad. Your cough or whatever symptom you're having, it's probably self-limiting, so my suggestion is you probably don't do anything, because I don't have any evidence to show that the herbal remedy that you want to buy is going to provide you with any benefit at all. So because these alternative remedies really haven't been studied that well, we're stuck with providing very equivocal answers, versus when you go and you say, well, you look at the brochures for, your detox kits or your cleansers, it'll tout the amazing benefits that you see there. You only need to look at the data on vitamins, and I'll come back to vitamins in a bit to show that really what may appear to be black and white is not black and white. If you want to take a break and kill that bee, that's perfectly fine. I know it really seems to be concerning you. So I think the other point that I want to touch on about why health is different is that it's really not about us, just about us. And there's broader implications to our decisions. And it's the public impacts. And I think that the first one is the financial impact. And because of universal health care is the fact that if somebody else in Canada is making very bad healthcare decisions, then ultimately that could be driving up the cost of the healthcare system overall. And so that should be of concern to us. We want to make sure that people have the information they need to make good healthcare decisions. And the second is public health issues, and I think vaccines are really the poster child. And I think, anti-vaccine advocates routinely ignore the effects of the lack of vaccinating of themselves and their children. And what we often see is that when there are outbreaks, you'll often see that the outbreaks of things like measles will often affect the children who've been vaccinated more than the children that haven't been vaccinated, often because vaccination isn't 100%. And so there will always be children who will not have a full immunity. And because the number of children that have been vaccinated is much, much larger than the number of children that are unvaccinated, that by creating a small pool of measles in a population, it will still affect vaccinated children to a significant extent. Even when they haven't vaccinated, you'd think they would be protected, but vaccines are not 100%. And it's by compromising that herd immunity is what puts everyone at risk. And this isn't even considering the number of people who can't actually receive vaccinations. So they could be immunosuppressed, they could be receiving organ transplants, they could be children not old enough to receive the vaccine as well. So, and I think that one of the issues in health as well is the patient isn't always paying the bill. So that's an advantage in the case that in general payers, and I'll use payers in terms of government payers or insurers, generally they're pretty evidence-based because they don't want to pay for things that they don't have to. And so if there's evidence to suggest that a therapy isn't that effective, in general, payers won't pay for it. But the opposite of this is that many health plans, particularly if you're employed, your health plan, your benefits will often include all types of insurance for different types of treatments. So I took a look at one benefit plan, that that a colleague of mine has available to them, and it included naturopathy, chiropractic, acupuncture, Christian Science practitioner, chiropody. All of these ones were included in the benefit package. So, and this is another reason why, so when these become benefits, the threshold or your willingness to pay, it's no longer an issue in terms of evaluating the value for money or the risk versus the benefit of the different treatments. So, again, as I said, the fact that you're paying, the fact that pseudoscience isn't always paid for, or sometimes is paid for, is something we need to consider as well. So the next reason why health is different, and this is more of a philosophical point, is that structurally, you know, our healthcare system is really largely unchanged from the 19th century in terms of how it is designed and how it delivers care. And this is a little bit unfair. This is a photo from the 70s, but you know, sure, we have antibiotics now. Our life expectancy is much longer, but fundamentally, the structures and the organizations that deliver our healthcare are largely similar to what we had 100 years ago. So, and in general, the healthcare system is not all that patient-centered. And I think patient-centered care is something that alternative healthcare providers do very well, because you may be in a consultation for an hour and a half, and you will have all your symptoms detailed and transcribed, at which point a personalized remedy will be prescribed for you. Whether that's based in evidence is another question, but it's that patient-focused care is something that in general the alternative providers do quite poorly, or do quite well, excuse me, and that in general the current healthcare system, the evidence-based healthcare system, doesn't do as well. So, and I think particularly our system is really largely designed around acute care. So most physicians and healthcare professionals like pharmacists are generally paid on a per transaction basis. You make an appointment because you need care, you go in, you get care. You want preventative care, it's generally not done as well by our current system. You need to have a family physician who is proactive, or you need to take active responsibility for your health. And I think that in general as well, alternative health providers, I think to the extent that they provide active interest and active management and taking responsibility for your health, that's good. I mean, I don't think anybody argues that, and I think that's an aspect that isn't done all that well in general with our current healthcare system. We have these large, enormously expensive institutions called hospitals that in general are impersonal, they're financially strained, they're fairly difficult to navigate. They deliver very good outcomes, as I've shown you by the aggregate statistics. But patients in general, you know, few would argue they're really designed around a patient experience in terms of, are you really satisfied with the care that you're getting? And, you know, as I said, I already pointed out, I mean, I think our system is largely designed around treatment and not prevention. And, you know, most chronic illnesses, and much of what people are dying from now, the vast majority of what people are dying from now are chronic illnesses. Much chronic illness can be prevented with what are fairly straightforward interventions. They're straightforward and they're simple. They're not necessarily easy, but they're fairly straightforward. You know, eating properly, exercise, healthy lifestyles. But, and now that we have the majority of deaths are due to these chronic diseases, you know, heart disease, cancer, and stroke are well more than 50% of all deaths every year. Diabetes is the leading cause of death, leading cause of kidney failure, amputations, and blindness among adults. And that the basic information around diet and exercise and lifestyle is absolutely critical. Unfortunately, a lot of the alternative medicine providers will wrap that up in terms of selling different supplements and different types of interventions that aren't evidence-based. But fundamentally, the things that we need to be doing are, as I said, they're simple, but they're not easy. The alternative medicine providers will tell you something that's easy, but not necessarily simple. So, and I think that the other aspect that I think that's really interesting today as well is that consumers today are really unlike past generations. I mean, when I graduated from pharmacy school about 15 years ago, we didn't really have any electronic references, and our big blue book, which was the CPS, which is the compendium of all the drugs available, that was an actual book. And then we got CD-ROM, and that was, whoa, we got a CD-ROM in the pharmacy, and we could access these monographs on CD-ROM. We'd get CD-ROM updates, and that was only in the early 90s. And now we're to the point where you know, everything is online. If I'm counseling someone who comes in to get a prescription drug, they've often already looked it up, and they're just waiting to see if I verify it, verify the information that they've said. Or they've already read up and decided that their physician is wrong and they want a second opinion with the therapies that they're getting. You know, we can look at the way, the differences in the way that you can access healthcare are very obvious now. When before you might not realize that a particular therapy or treatment is available in another province, it's very easy to find that out now. And you know, consumers are increasingly demanding access and care according to their own terms. They're insisting on being heard. So The first box, the one that says find patients just like you, that's from a website called Patients Like Me, so people with chronic diseases can connect and establish social networks, which is fantastic. Some of these rare diseases, there's only a handful of people in Canada that will have a particular illness. Natural News, if you haven't looked at this site, you should, although your brain might explode, because it is some of the most creative writing with respect to health that exists out there. But it's certainly interesting to read just to see what the arguments are and what's being said about kind of the conventional medicine systems. And 23andMe is basically, I believe it's a Google-funded enterprise, which is basically offering genetic testing and your entire genome. You're going to be able to buy it in, probably in less than a decade for under $1,000. So, you as consumers will have more access to information, and you'll be able to use that in a very proactive way. And I think what this means is the end of paternalism in medicine, which is a good thing. But we have to balance that off with recognizing that there's still a considerable amount of expertise that health professionals hold. And just because you've spent an hour looking up something on Google doesn't mean that you're an expert in the treatment of a particular illness. So, and I think that this leads into my next point, that I think as dissatisfaction grows with the healthcare system in terms of the impersonal care, I didn't get a lot of counseling on my medication, I looked at this information online, I don't know how legitimate it is. I think that what we're seeing more, really at the extreme, is really the embracement of scientific denialism. And I think from a health perspective, there's no evidence at all that governments and payers deny science. In fact, it seems to be obvious that they embrace it. I think we're certainly seeing this more at the consumer level now, which is, and denialism, just in terms of, as a quick term, is really the use of false statements to create the illusion of debate. It's really the willful denial of facts and evidence. There's an entire blog called Denialism Blog, which you haven't checked out. I suggest that you take a look at. So one of the things that feeds into denialism is players behaving badly, and this is pharmaceutical companies. And I tell my colleagues that work in the pharmaceutical companies that pharmaceutical companies are their own worst enemies. They have a tremendous role in delivering and bringing drugs to market. And the role of bringing drugs to market from clinical trials and actually getting them into pharmacies and getting them prescribed is something that every society has outsourced to pharmaceutical companies. It's a conscious decision within society that private companies will take on that role. But unfortunately, commercial enterprises behave as commercial enterprises will, and they will do things that are unacceptable, and they will do things that are not appropriate. And it's important that they be held to account for that. And I think that the best, the criticisms around burying negative clinical trials, to marketing drugs for unapproved uses, to withholding data on safety, I think it just reiterates the fact that we can't take anything at face value. We need to hold companies to account. We need to be as critical with scientific evidence that's coming from pharmaceutical companies as we would for anything else. We certainly shouldn't be having a double standard. But I think a lot of this is really an argument for better transparency in the process. We need a clear disclosure of conflicts, of data, and so when we're evaluating the science, that there's actual science to look at. I think that's part of the frustration I have with looking at data around alternative medicine, is often there's really no data that we can even look at. Now, I spoke a little bit about kind of Googling information, and I think that the Generation Rescue group with Jenny McCarthy really epitomizes to me this arrogance of ignorance and the implications of using simply Google to get your health information. You can get just enough evidence online to think that you know what you're talking about, but really not enough to appreciate the depths of your own ignorance. And that's what the arrogance of ignorance is. And I think that the reality is that because of the way that information is organized, that no matter what opinion that you have about any healthcare intervention, you will be able to find a support group for it online. Like, I made a joke one time about people relying on the whisperings of dolphins to provide them with healing information, and sure enough, there's people who are into dolphin whispering, and there's a website about it. I was just astounded. I realized that there's anything that you want to find, you will find online related to healthcare. So, and I think that once you've made up your mind for a lot of people, that it becomes a faith issue, not an evidence issue, and you can keep turning to the evidence to your preferred sites. And I think columnist Dan Gardner in the Ottawa Citizen is a superb blogger, calls it the warm bath of confirmation bias. So you can really find whatever whatever idea you have, you can find it online to support you. So that's really what I want to talk about, how health is different. Now, what I want to talk, my next point is really that pseudoscience in healthcare isn't always easy to spot. So I think that what I want to start with highlighting is really that a lot of the products are so common, really that we can miss them. And I think that the case of Simon Singh and the British Chiropractic Association really highlighted for me that. And I'm not going to talk about chiropractic today, but I think that what's interesting is I didn't realize that the extent that I think chiropractors are, providers in Ontario that are very well established. And but that's not the case in other jurisdictions. I think the same is within naturopaths within the healthcare system and within the provinces, because we have a naturopathic school in Ontario. Is that there's certainly more, in terms of naturopaths per 1,000 people in the population. I think it's much more dense, I believe, in Ontario and British Columbia than probably most of the United States, because there's not as many schools in the States, and they're more distributed. So let's talk about, I just want to talk a little bit about homeopathy, and I don't think I need to spend a lot of time on homeopathy with this audience, but homeopathy is this alternative medicine system invented in the 1800s, really involves three main concepts: the like cures like, individualized treatments, and less is more, which is the water has memory, and the more you dilute it, the stronger it gets. And I think that some of the misconceptions around homeopathy, certainly that I've encountered in speaking with patients in pharmacies about it, particularly in pharmacies where I've worked that sell homeopathy, is they believe that homeopathy is akin to like a vaccine. So they think, well, it's a small amount, it boosts the immune system. So, but, and I think they really, and I think even health professionals as well, really have a lack of understanding about statistics and what clinical trials mean. When you do a number of clinical trials on a topic or on a particular subject, or to answer a particular clinical question, is unvariable. That simply by the way that we do statistics, that some trials will end up being positive. And so the importance, as I pointed out my hierarchy of evidence before, is we have to look at the totality of evidence and not be cherry-picking data. And I think that's something that homeopaths do quite well. So, but the more that I read into homeopathy, it's just the more ludicrous it becomes. I was looking at some of the remedies, and I think we did a post on Skeptic North, really trying to say guess the fake remedy, because it included absolutely everything. And one of my favorite ones now is the Berlin Wall. So someone took a chunk of the Berlin Wall and they did a proving. So I guess they took a piece of cement and they handed it around to people. And a proving is basically you sit and you hold on to the remedy and you describe what you're feeling. And so I'll read to you, this is a bit from the proving for the Berlin Wall remedy. You can actually look up the proving online. So here's the proving. I am in a new room. I am in a new room. A stranger. Nobody wants to have anything to do with me. German language is spoken. The room is a kind of cellar, half underground. They cannot see me, really. There is something with their eyes. I want to touch people all the time that I detest in myself. And it goes on for about another page. So that's a proving. That's the evidence that homeopaths are bringing forward to justify the effectiveness of the remedies. It's just, so yeah, there's my other personal favorite is the light reflecting off of Saturn, and I encourage you to look at another Skeptic North post where they took some lactose tablets, put it on a plate, shone a telescope at Saturn, and then passed the lactose tablets around to do the proving as well. So it's a remarkable proving. I really encourage you to read it. The next one that I want to point out really is diet products. Diet products abound, and from stores like Herbal Magic, which I think is an ingenious name, Herbal Magic. I mean, it's an amazing name. To the proliferation of really these fake diet remedies that litter pharmacy shelves, it's easy to forget that weight loss is really fundamentally a function of caloric balance. And companies that make these products, I think in general, treat their customers with contempt. And I don't think many have any intention of making products that have any benefit. And I had to take this particular ad I just love, because not only is Hoodia completely ineffective and it's in a patch, but they couldn't even spell lose right. So the effective way to lose weight. So eat more calories than you burn, you gain weight. Burn more calories than you eat, you lose weight. And one of the things that I tell consumers is that there's really nothing you can buy without a prescription that's really going to change that equation at all. But people really want to have easy solutions. And it's very hard to tell as a pharmacist for me to tell people that there aren't easy solutions. And if people are telling you that you can take a magical pill that's going to burn off calories, it doesn't exist. It's not possible. I have a product that I profiled on my blog called Mulberry. It's a product called Mulberry Zucker, and it's my biggest product. I have hundreds and hundreds of hits per day. There's some data that it might impact on sugar levels. There's no evidence that it helps weight loss at all. Astonishingly, it's been approved by Health Canada. It's filled with comments from people who say that I'm a big pharma shill because I deny that it works because they took it and it works. And they say that I'm trying to block access to their trusted nostrum. But what's really interesting is I found that this particular remedy, so the search for mulberry zuckerin is like the biggest keyword that comes to my site, my blog. The second biggest one is mulberry side effects. So people are experiencing side effects, it appears, from this particular remedy and searching for it. So I did a follow-up blog post basically saying, here's how you can report your side effects to Health Canada. So vitamins are a really interesting area. Now, alternative medicine advocates take it really as a matter of fact that vitamins can treat all kinds of illness. And naturopaths will sell intravenous infusions of vitamins, and you can buy these pick-me-up treatments, really not supported by much more than a lot of anecdotal evidence. And vitamins are therapeutic substances. We need them in our diet, and we can't synthesize them except with vitamin D. But the question of whether supplements are necessary is difficult to answer. I mean, there's good evidence to show that folic acid supplements will help to reduce the risk of neural tube defects in pregnant women. And there's evidence to show that antioxidants plus zinc are recognized as evidence-based treatments to prevent age-related macular degeneration in certain patients. But we also know there's evidence of harm. For example, if we look at beta-carotene, it appears to raise the risk of cancer in smokers. Folic acid may also raise cancer risks as well. And I think what's coming out is as the science evolves and the evidence emerges, it seems that vitamins may be more like the nails that are used to construct a home, and that you need some to hold your home together, but you keep hammering nails into the joists and eventually the wood starts to crack and it actually might start to decrease stability. So I think it's risky for us to say, oh yeah, you should just be supplementing. More supplementation is good because vitamins are good. I think that there is evidence of harm with certain vitamin supplements, and it's important that we really look very closely at the evidence before we start recommending widespread supplementation. Now, I want to talk a little bit, set aside products and talk a little bit about practices here. Just some of them that I think as well, they have a veneer of legitimacy that has helped to improve acceptance as well. So detoxification and cleansing are really, they're really just pseudoscientific delusions. There's really no evidence to that detox products that you would buy in a pharmacy have any effect. And I think that detoxification actually, it's been really widely embraced in the culture, from foot soaks to colonic irrigation to scrub brushes to ion baths to all these different treatments are related to detoxing and cleansing. And detox to me is really one of the most, I think it's the most straightforward product that anybody could demonstrate that it works. First, tell me what the toxins are that are hurting us. Second is, show me that the product that you're going to sell me or the treatment actually removes those toxins. And the third is, show me that the toxins have been removed. And the last one is, once you've removed the toxins, show me that I'm better. I mean, it would be fairly, I would see it as being fairly straightforward for someone to demonstrate, but there's really no evidence. Even just asking what toxins are going to be removed is a question that you can ask anyone who's selling you a detox product, and they will typically be stumped. They won't be able to tell you. And if they give you that, you can ask how they know that those toxins are being removed. And it's something that really, it can't be answered. But I think that in general, the concept of detox really lets us continue to believe that we can kind of purge all these bad behaviors that we do with kind of a quick fix and continue without any permanent changes. Now the next one is the allergy term, and this is a Vega machine, which is a bogus machine that tests the resistance in the skin, electrical resistance in the skin, and it's used to diagnose allergies by alternative health providers. It's actually been banned by Health Canada, but it continues to be widespread use. If you search Vega machine in Canada, you'll find all kinds of different providers that will use it to treat and to diagnose allergies. And another way of diagnosing allergies is something called applied kinesiology. And the Skeptic Zone podcast, if you haven't seen it, they did a recent YouTube video on applied kinesiology to explain that. I won't get into it now, but typically what would happen is you would hold a food or an amulet or something, and then they'll do some kind of test. So you'll hold the food, and then they'll push down in your arm, and then they'll say, okay, put the food down, and they'll push down. They'll go, oh, look, you must be sensitive because now I can't push down your arm as much. But it's been debunked repeatedly, but it is used to diagnose allergies sometimes. And I think that the real concern that I have with allergy testing is that parents and children are being given these impressions of allergies that aren't true allergies, that don't exist. And so Parents and kids have to struggle to adjust their diets to compensate for all these foods that need to be eliminated. And finally, the kids head off to school with all these products that they're told that they're now allergic to. Now, I have a family member who has a true allergy, an anaphylactic allergy, who has to carry an EpiPen. And my concern is, as a parent, as a health professional, is we need to take allergies seriously. And so we need to make sure that when we tell someone that they have an allergy, whether it's to a food or to a drug, that they really do have an allergy. So I saw a school list of banned allergens at one of Toronto's alternative schools. And I want to show you the list of what they said you could not send your child to school with. And it's astonishing. So dairy, eggs, bananas, nuts, peanuts, all soy products, flax seeds, kiwi, chicken, and bacon. So some child was told that they had a bacon allergy. And I looked in the medical literature. I can't find any evidence of an anaphylactic allergy to bacon. Now, I'm not ruling it out, but I just find it astonishing that one classroom of 30 kids would be told that, you know, that they would all have this collection of allergies, and then the challenge for parents to say, well, you know, you don't send any of these products with your child to school. When I think we'll see in general the anaphylaxis most commonly to peanuts. You know, we could see it to soy, to some of the other nuts, but really to have this level of allergies that are being told to parents, I think is concerning. So the third point that I want to point out is that the drivers of the integration of pseudoscience in healthcare, they're not really easy to monitor, and they're not being monitored routinely. So I just want to kind of highlight a few of the drivers that I see. And the first one is health freedom, and this is a photo taken by a CFI member, Mitchell Gerskup, and it was taken at the, I think it was called the Health, sure it was Mind Body Wallet or Mind Body Health or Health Food Expo. It was a health food expo that was held in Toronto late last year. And Bill C-6 is a consumer protection law around products, basically giving government the right to recall products that they've been deemed to be unsafe. But this was a sign up at one of the booths basically complaining about Bill C-6. And this ties into the term health freedom. And advocates use the term health freedom to argue that the consumer choice is really of greater importance than any regulation that might limit access to consumers. And it seems to have found resonance with natural health product producers, because natural health products are safe and effective, of course. And so, you know, not that there's any evidence of either, but so it's used as a way of framing the debate to say that we should have access to these products, and you're denying our health freedom by doing so. But in general, I think health freedom seems to benefit the manufacturers and the purveyors of these products a lot more than consumers. And to me, my mind, it's not clear how consumers benefit from access to products when they don't have any assurance that the product or treatment that they're buying is safe, or it's effective, or it's even based in reality. But it's clear that you can use this as a shield by which you can argue against consumer protection regulations, you know, flying this flag of freedom. And they're supported in part by people who genuinely believe that these products provide benefit. But that these products don't or can't meet the current standard of medical care. So they move to label the current standard that exists in place for products as being biased against them, and then they'll do whatever they can to subvert that. So I went to one of the Canadian health freedom sites, and here's just another image that I wanted to show for you. This was around the time of H1N1. You can see the World Health Organization logo and the surrender your supplements and submit to the shot. The second point that I want to identify, I don't want to spend a lot of time on this. I could spend an hour just talking about the regulatory product framework for natural health products. That in a way it really does legitimize pseudoscience. And there was a few posts about this on Skeptic North if you're interested in this. But essentially, until several years ago, natural health products fell into a regulatory gray zone. They weren't drugs and they weren't foods. So there was a move in the late 90s to develop a new framework to provide appropriate levels of regulation, kind of recognizing these two facts. And in 2004, the natural health product regulations were born. And basically, it was a regulatory compromise. So saying, well, we recognize that these products will never have the standard and the data around them that drugs will, but we also recognize that there are claims being made about them, and they're not truly food products. So what it did is it relaxed the standard that could be applied. So if double-blind placebo-controlled trials can't be done, then claims can be made based on traditional use. So if you've been using a product for an extended period of time, you can say traditionally used to treat. It doesn't actually infer that the product is effective in that, but just that it's been used in that way. But I think what's most concerning with the regulatory product framework in Canada is the fact that homeopathic products fall into this regulatory framework. So we now have Health Canada is actually regulating and approving and assigning distinct product licensing numbers to indistinguishable bottles of lactose tablets. So, you know, it's impossible with most homeopathic remedies, once they've been diluted sufficiently, there's no chemical products inside them. There's no way you can distinguish between one product and another. And yet Health Canada, through its natural health product regulations, is actually assigning these different bottles individual numbers with different treatment claims as well. And so there's an advisory board for natural health products now within Health Canada that includes a naturopath and a homeopath on their advisory board. And if we look at the references that can be used, and I talked about those provings, some of the provings date back to the 1854. So this is even before germ theory. So some of the evidence that can be brought forward to support the claims being made about homeopathic products, the references that were written were before people even had a conception of what germ theory was, or what pasteurization was, or before incandescent light bulbs were available, or before we identified X-rays, and 30 years before the first drug was developed. So it's actually quite remarkable that this framework is really in place. And what it does is it establishes these products as being safe and effective. And I think that what this spills into provincial regulation, and what that can mean is regulation can mean legitimacy for practitioners that don't necessarily use science. And so we saw that with British Columbia, who allowed prescribing rates for naturopaths in 2009. And in Ontario, there was a movement that's now moving forward as well for naturopath prescribing as well. And really, this is because regulatory and advisory boards are taking what's being provided in terms of evidence at face value and not looking at it from an evidence-based, science-based perspective in terms of, is there any legitimacy to the statements that are being made? So you'll see regulatory and advisory groups accepting acupuncture, oriental medicine, botanical, herbal medicine, homeopathic medicine as legitimate healthcare interventions. And I kind of liken this to unicorn breeding, a degree in unicorn breeding. You can get a degree in unicorn breeding, you can get a PhD in unicorn breeding, but it doesn't mean that unicorns exist. And that's how I liken the regulation of the alternative medicine providers. But the reality is that this is moving forward, and so we need to have organizations, and we need monitoring and scrutiny to identify what's happening and occurring so that we can provide intervention and provide input into the consultation when it takes place and at the right time. So, as I said, pseudoscience isn't always easy to spot. So I want to get to my third point now, which is really that if we're going to affect change, that we need to work at really 3 different levels. And I think that we really have to start working at the individual level. And this is really your discussion one-on-one with someone else about alternative medicines. And I think that if there's a good web podcast I'd like to plug. It's called Actually Speaking, and it really just talks about science advocacy, but not actually talking about the science itself, but just about communication styles and techniques and how we do that. And when we're dealing one-on-one with people, we really need to use different tools and skills to help us get our message across. And sending a link to an article really isn't that effective. And I think that with respect to vaccines and the concerns around vaccines, I really think we're going to be dealing with the concerns around vaccines really one person at a time. So there's a paper that I blogged about that I encourage you to take a look at if you're interested, and it's called A Postmodern Pandora's Box, Vaccination Misinformation on the Internet by an individual at McMaster University. And what this author did is really looked at the different reasons why people reject vaccines. And I think it's important when you're talking to someone around why they may be concerned about vaccines or why they may like a particular alternative health product, is to really get an understanding of what their issues are and why they feel that way. Because certainly with vaccines, and what this author pointed out is that there's concerns about safety and efficacy. There's concerns about civil liberties sometimes. There's conspiracy theories. There may be morality, religious issues, ideology issues. There may be emotional issues that are being identified as the reasons. And unless you understand the actual issues behind the position, you really can't provide any information that's responsive to actually help to address that. So I encourage you to take a look at this article on the Science-Based Pharmacy blog, and to check out the Actually Speaking podcast as well. And I think, and this ties into my second point, is that you can't, just pointing to skeptical resources is not enough. I mean, I write my blog really, my first audience, I write my blog first to pharmacists, to challenge them about what's occurring in pharmacies. And the second audience is for kind of the science literate people who are interested in this. But I don't expect people who are not all that interested or already have fairly strong opinions formed around that to take an interest in what I'm blogging about, or they might not find the audience of, say, the science-based medicine blog to be all that compelling as well. And I think that gets back to my prior point, where we really have to be translating the information effectively. And I think the hardest thing, the biggest challenge that we have is translating gray, about the fact that we don't have answers, and that we have to accept that as part of the way that science works. I think it's human nature to want to reject the cards that fate has dealt us, and people don't want to accept a diagnosis or a condition, and they want to explore every treatment option, and that's great. But the reality is that a lot of the pseudoscience industries know this, and this is what they prey on. It's really challenging for us that we have to be able to dialogue and do that at an effective level. But I think we also need to really be effective at the organizational level, and the protest that occurred in the United Kingdom related to Boots was one I think that was fairly effective, because it really challenged and highlighted the use of homeopathy and the sale of homeopathy, and the decision by Boots Pharmacy in particular, and by the pharmacy profession, to be selling homeopathy, and how it was inappropriate. So, and I think that they really that was very effective as well. The other area where we need to focus our energy is what other people call quackademic medicine, gaining a foothold in Canada. This is a nurse doing therapeutic touch at a college in British Columbia. But at the University of Toronto, the Leslie Dan Faculty of Pharmacy sponsored a natural health products seminar that included pseudoscience being peppered through the program, including homeopathy for chronic pain. And surprise, surprise, the program was sponsored by Boron, which is one of the largest homeopathic manufacturers in the world. So when you have sponsors of University of Toronto Faculty of Pharmacy programs being sponsored by homeopathic manufacturers, I think that's quite a concern. Professor Larry Morin, who's you probably all know well, his Sandwalk blog, he identified complementary and alternative medicine course here at U of T. Another one is an example of pseudoscience on campus. And I think as well, the other areas that we want to talk about is professional organizations. You may have seen a little bit about this, the Autism Canada promoting the biomedical treatments. Originally, this brochure, when it came out, this was being held at the U of T, but really I think they just rented the space. But it was being promoted it was listed as being affiliated with the Dalla Lana School of Public Health just down the street, which was later clarified that they were not affiliated with it, so the name came off the brochure. But what's unfortunate is that this program, which was promoting homeopathy and biomedical treatments for autism, received a grant, a sponsorship grant from the Hospital for Sick Children, the Sick Kids Foundation, which I think is really unfortunate. And so it's only a small grant that Sick Kids provided. I think it was about $5,000, but still it allowed this organization, who really promotes non-science-based treatments for autism, it allowed them to put sponsored by Sick Kids Foundation. You know what? That's worth far more, to my mind, than what any level of any financial sponsorship. It's that veneer, that implied credibility that you're getting from sponsors. Media coverage, I think, in general in Canada varies from the very skeptical, excellent, to the highly credulous. There's an ongoing column on the Skeptic North blog, if you don't see it, called "The Skeptic Wins and Fails in the Media" each week. I encourage you to check that out. And there's some great critical work that's done by media people, Andre Picard, Dan Gardner, as I've already pointed out. Colby Kosh does some good skeptical blogging as well. Rob Breckenridge is a radio host in Calgary, does an AM host, but has a very skeptical viewpoint, very science-based viewpoint, and seems to be a strong advocate for science-based medicine. I just highlighted this one as well, which was just and the Globe in general I think is usually pretty good, but this one was actually quite poor. That was a very non-critical piece on a naturopath who took 100 pounds of homeopathic medicine to Haiti, and he started to administer these homeopathic remedies for children with scabies. And on his blog, he was describing how he's bringing the miasmic theories to Haiti. And I had to look what miasms were, but miasms were what people believed in before there was germ theory. So this fellow was taking this pre-germ theory of disease. He was happy to be taking it to Haiti and to be talking about it there. I think it's really important to call out and highlight, good and bad media reporting. I personally wonder if the comment section really on any of the media sites has any impact at all, and I think that's why we're lucky to have the Skeptic North off the ground, that we can use that as a foil to really highlight what we think is good. And I think this, my next point is that where I think that we can have the greatest aggregate effect is that we really need to push to keep policy and regulation science-based. And I think we need to understand the enablers and barriers that are facing practitioners, as I pointed out, understand what the drivers are, when organizations can impact, and how we can impact at the government level. We need to understand the implications of product regulations as well. So pressing for regulatory changes. Why does Health Canada continue to approve homeopathy? Why are pharmacies selling homeopathy? Because Health Canada says they're legitimate products. There was a direction put out to pharmacies that said you should not be selling products, natural health products, unless they've been approved by Health Canada. Because Health Canada's approval means that those products are safe and effective. But unfortunately, homeopathy is a Health Canada approved product. So pharmacies have a legitimate case if they're following the guidance of the regulators that say, well, we're following that because Health Canada's approved it. So we then have to take the argument to Health Canada. We need to understand the marketing and advertising standards and use them. Just briefly, this bill, I mean, there's no way a pharmaceutical company could ever get away with an ad like this, but this pomegranate juice, cheat death, I was astonished. I had to take a picture of it. Their whole advertising series is blanketing the city right now. Is actually quite astonishing, but this one about cheat death, I had to stop and take a photo of it. But using marketing and advertising standards is one way I think we can be quite effective. I mean, I think if we look at what happened in the United Kingdom was very, very effective, where there was a regulatory quirk identified in the United Kingdom by a British blogger who noticed that if the regulatory council had made a ruling about a particular claim that was inappropriate, then chiropractors weren't allowed to talk about that particular treatment. And so what the bloggers did is they pulled off all the things that chiropractors couldn't talk about. They Googled every single chiropractor, their website, and searched for those keywords, and then they submitted 600 complaints about chiropractors to the Regulatory Council, which had the result that there was a 15-fold increase in complaints against its members, from 40 a year to 600. And they had to hire, I think, 6 new staff within the council just to deal with all the complaints. But this is really an effort. This is I think, a remarkable a success of really just using the existing regulatory standards to actually say, enforce what you've been asked, you say your standards are. So I want to wrap up now. So I mean, as I pointed out through here, I said at the beginning, I think an embrace of pseudoscience is leading to bad healthcare decisions. And if we want to be driving individual and societal health decisions to be based on the best evidence, and if we want to bridge this chasm, that we really need to have effects in 3 ways. So I think we need to recognize that health is different. We need to recognize that pseudoscience in health is not easy to spot. And thirdly, we need to be working at 3 levels. We need to be working at the level of the individual, the level of the organization, and we need to be working at the government and the regulatory level as well. I'm slightly over my time. I appreciate my opportunity to speak with you today. So at this point, I'm happy to take any questions. Thanks. And I've listed all my different ways you can get a hold of me.
Hi, is the sale of homeopathic remedies really compatible with whatever the equivalent is for pharmacists of the Hippocratic Oath? Is it compatible with, I guess, the professional oath of pharmacists?
Well, I think that's a great question, and I would argue no. I think certainly a lot of my effort has been, and if you've read my blog at all, I've been arguing very strongly that homeopathy doesn't have a place in pharmacies. I think it should be removed. And I am working, what I do is I think that pharmacy needs to voluntarily make the decision to remove homeopathy from pharmacies, as pharmacies did with tobacco. It was a voluntary decision because I think that it's a professional obligation, I see that, and I think it's incompatible with the role of pharmacists as health providers to sell homeopathy. And so I continue to work at multiple levels personally in terms of building the case for having, first calling attention to it, because I think most pharmacists go, where do you draw the line in terms of what we're selling here? And so, and there's a lot of arguments that are made by pharmacists, and if you followed the arguments around the 1023 complaints and around boots, I don't think they're all that credible, and I think from a professionalism perspective that homeopathy needs to be removed from pharmacies.
I and my sister both suffer from gout. I went to my doctor. He prescribed something for me to take when I was suffering. It works. My sister went to her doctor. And he told her, I'd rather not prescribe anything for you. So she goes online and finds cherry juice and various other dubious things recommended by various different people. My question, I think, illustrates the problem from the medical side. You're not getting consistent information from the professionals, and also the situation in a particular illness.
Yeah, I think that's a great point. I think in general, physicians don't prescribe consistently and always according to what best practice guidelines do. And I think that's one of my reasons why I really enjoy being in pharmacy, because I work related to helping to improve drug use at that level. But I think that's a good point, and I think that there's a lot of improvement for the way that we use medications, both from a clinical perspective, just what the evidence says, but also in a way that's cost effective as well. So while there is often underuse of drugs, there's often tremendous overuse of medications as well. And I think that's a very valid issue, a very valid complaint. It doesn't, and that the problems with prescription drugs are often used as an argument for the legitimacy of drugs without any evidence. And I think it's important that we don't do that, is that we recognize that there are problems in the way that we use drugs, and we recognize that there are hazards, and they're not always effective, they're not always prescribed appropriately. Hi.
Hi, homeopathy, I just had a thought. It seems to be similar to a lottery ticket. It doesn't really hurt you, and the government gets a little cut of the action, so they have no financial incentive to ban the stuff.
Well, I don't know. I guess I mean, their cut would be related to tax, I guess, from the sale of that product, instead of just telling you to self-manage it. But they also have a regulatory system that actually has to cost them to license and sell those products. And the costs for licensing are a drop in the bucket compared to the cost for licensing for drugs, for conventional drugs. Like the cost of getting a site license and the manufacturing license is very, very small. So I would say from a perspective as a government, I would be concerned from a couple of different levels. I would say if people are buying homeopathy and it's not doing anything, then they could potentially be avoiding treatment for something that could potentially get worse. So while there may be occasions where, my advice would be to say, don't do anything, just go home and rest, and somebody might buy their homeopathic product and feel better. There could also be the case where somebody would buy a homeopathic product when they should actually be getting proper medical treatment. One of the changes that's happened that's positive as part of Bill 179, which was just passed, is that it's going to change some of the abilities of pharmacists. It will give pharmacists increased autonomy to extend prescriptions and to potentially renew your prescription without you having to go to see your physician again. So I think that's recognized as an issue. I mean, right now, right now with you, the issue is between you and your physician, who doesn't want to grant telephone renewals, because in most cases, the pharmacist can call on your behalf. But it's really up to the physician whether or not they want to do that. Some physicians insist that they want to see their patients to do the renewal.
Why do they have that right? Like I'd rather not go in a separate appointment. I'm a busy person, and I seems to be an infringement on my right.
Well, I think that's a good point. I think ultimately that's really an issue between you and the physician that you've chosen to provide you with care. But as I said, I think that's going to be changing with the new bill and increased autonomy for pharmacists that will help to bridge that gap in terms of making sure that you can stay on your medication without any interruptions. Okay.
I just have one other point. I just wonder what your opinion is. There is another theory about human health, if you will, going back 50, 60 years or whatever. As you showed the graph, the life longevity is increasing, but there is some evidence to say that it's increasing because our knowledge of certain procedures is increasing. Like 50 years ago, if you had a triple bypass, well, you didn't have one, you just died. And as you mentioned, certain drugs, etc. There's also certain medical measurements that have been made that state that our condition today is a lot worse than it was 100 years ago. And this came with the invention of the car. That as soon as the car came into interview, we start walking less and et cetera, so that our condition, and this also leads to the growth of allergies and all kinds of other diseases, that it seems that our knowledge of modern medicine, or medicine in general, is increasing, but so is the number of diseases. So every time we discover a procedure, there's another disease. So you know, there's room for concern here. We may not be as healthy as we think. You know, we live longer because we're carried by medication and procedures, but that's not necessarily good health.
Well, you made a couple of points. I mean, the first is that you were talking about treatments, and I think that's important. Interventions is important to mention, and I should have been clear at the beginning around my points around the medical. When I talk about modern medicine, certainly includes interventions such as things like bypass. I mean, when people used to have heart attacks, you'd get morphine and you'd just rest. Now you can get a bypass. You can be whisked in and have cardiac surgery, and so those types of interventions have made a tremendous difference as well. And you're right that certainly the way that our lives are lived has changed. But I mean, we're really lucky now to be dying of illnesses, chronic illnesses, because the acute ones aren't killing us anymore. We're not dying of infections, and we're not dying in our 40s and 50s. We're dying in our 70s and 80s and we're dying of cancer and heart disease, but that's because we're living longer, because eventually we're going to fight off every illness that we've got except for one in general.
Yeah, but we're so drugged the last 10 years of our lives, and we're living robots. You know?
Yeah, that's a good point. I mean, I think that it is always a trade-off when you're looking at medications, what the benefits and the risks. And certainly, I mean, I know people who are on 15, 20 medications who are in their 80s, and some are on none. And I think it's a function of all the different determinants of health that have led you to that point.
I've actually wondered for a long time how Health Canada or FDA have allowed a lot of these therapies to be used when there's no scientific basis. And you said that they allowed them because they've been in traditional use. So the word traditional comes in. How do you define traditional? Is it being used for 100 years, for the last 5 years? Or?
There is an actual definition that Health Canada has for the traditional use. The interesting thing about homeopathy in particular is one that, because it has been around for so long, it was actually kind of I think particularly with the FDA, I'm not as certain with Health Canada, but with the FDA, it was actually grandfathered in to when the FDA was established, homeopathy was essentially grandfathered in the Food and Drug Regulations in the States because it was already in existence. And in Canada, it's a slightly different framework that's applied, but homeopathy has just been rolled into that, the regulatory framework. But I'd encourage you to take a look at if you're interested in like the definitions around traditional use, it is actually defined on Health Canada's website.
So as long as they've mentioned it in their website, it's
I believe, and I'm not certain, but if you can provide a reference to demonstrate that a particular therapy has been used for X number of years, then that's your traditional use. It doesn't mean that it's effective, of course. It just means that it's been used for that condition.
And also, there seems to be a growth in consumer demand for alternative medicine. A lot of hospitals in the U.S. now have a department that offer these services, which include massage therapy, homeopathy, naturopathy, and so on. And it doesn't seem to be, on the one hand, the government there, maybe here too, is trying to regulate it because there's not a lot of evidence, as you know, of supporting these. But they grow, so it seems to be a conflicting kind of a situation right now. What's going to happen? Is it going to be regulated, or is it going to...
It's a difficult question to answer because, I mean, the regulation of healthcare providers are done at the provincial and state level. And decisions made about what therapies are introduced or provided at different hospitals is really done at the hospital level. So, and the American model is quite different, as you know, than the Canadian model in terms of what's being provided. Just because, I mean, if a hospital in Canada decides they want to provide a particular service or something, if they can pay for it, they can pay for it. And I think we also have to distinguish between things that are I would say that are probably more for patient satisfaction, so things like massage and things, versus things that are implied as being therapeutic, which would be like intravenous vitamin C from a naturopath or something like that.
Scott, I'm still puzzled. Pseudoscience medicine is ineffective at best, mostly, or even harmful in some cases, why is it that an increasing number of people want them?
Well, as I tried to point out, I think that it's multifactorial and that I think people want to take responsibility for their health, and I think that's a positive thing. I think people are looking for answers in the gray areas which science can't deliver a particular response. I think that pseudoscientific responses are positioned as being and marketed as being solutions to quick fixes to what are difficult conditions to treat. So I think that there's a number of different reasons.
So it's based on deception.
Well, I don't think it's necessarily a conscious deception. I think it's multifactorial. I think consumers are looking for. I think in general consumers want therapies that they're looking for, and I don't think necessarily that the people that are providing the therapies are necessarily being consciously deceptive. I think that they're just providing therapies for which there isn't good evidence to support their positions.
So that's mass delusion. They are deluding themselves that this is something that whatever could help you.
Well, I think it's also a personal decision as about what do you want to, how much evidence do you want to support something that you're doing for your own health? And I think that it becomes a value judgment in terms of whether you want to accept to do a treatment without having any evidence to support that it's either effective. And I think what people forget is you can do things like vitamin supplements that you think, well, they don't hurt, but we don't know that either. And I think that that's the risk benefit ratio, which I think in general we have a better understanding with a lot of conventional medicines, and we generally don't have any information at all with respect to a lot of the alternative remedies.
Do you have any indication on how far the popularity of those medicines will keep growing?
No, not offhand. There's some information from Health Canada around the size of the market, but I can't remember it offhand.
Hey, so I was at Garden Centre the other day and picked up a bottle of a product that was making remarkable claims about how this product would spray it on your plants and they'll grow bigger, stronger, and greener and resist pretty much any plant disease out there and fight off bugs. Wow, this is amazing. What's in it? And looked at the product list, the contents, and it listed 4 or 5 rare minerals that I hadn't seen in plant food or anything before. And okay, wasn't until I looked really closely and saw that this was a homeopathic remedy. That I
genius. It's genius. I wish I'd thought of that.
But so it's basically water, which I suppose is good for plants. But so I then went on their website when I got home, and in amongst a whole bunch of pure pseudoscience bullshit about how the nanotechnology communicates with plants and so on, they point out that the active ingredients are present. It's a billionth of a gram of the active ingredient there, so it's on the less is more idea.
It works at the quantum level.
Yeah. My reaction to this, and I mean this is similar, of course, with human medicine, the kind of claims that are made. Surely this is a case of false advertising, and how is it that there aren't laws preventing this simply as a case of false advertising?
Yeah, I think that's a good point, and I think that there's probably an underutilization, as I pointed out, of consumer advertising standards bureau complaints and other types of consumer protection venues that are, I believe, are probably underutilized just by the nature of what I see advertised. I mean, I correlate this with pharmaceutical advertising, which you don't see because in general pharmaceutical advertising isn't supposed to go to the public, but pharmaceutical advertising to health professionals is very tightly regulated in that if I see a claim that I don't think is substantiated, I just send an email saying I have this, I scan the ad, send it in, say this ad is not, I don't see any evidence for this particular claim made by this drug company, and it's investigated, and then I get a letter of resolution saying we've investigated this and this is our judgment. But I haven't explored that with products like that, but I think it's consumer protection regulations, and I think a lot of this is really, it is a consumer protection issue. If you're being sold water for plants, which is really a genius idea.
What they get away with
Well,
selling water
I would
to
sell.
people.
See, I would sell a small bottle, and then I would just say dilute it, because then you make it stronger.
Oh, they do.
Or maybe when you run out, you just keep adding water, and it gets stronger and stronger,
Yeah,
right?
one-
You just
one-
shake it in between.
One bottle will feed 30 plants. It's a
One
small
bottle, you only buy one bottle.
Well, as regular medicine is really, it has to be what it's called. I'm looking for an English word here right now. We can make claims against regular medicine while we can't do that against homeopathic medicines, and that's also a trap we're falling into. Homeopathic medicine doesn't have to show us all the times when they are not succeeding, while regular medicine we have to show that this medicine didn't work, and we have to keep the statistics of it. But that, back to my question, is there any kind of umbrella organization that fights for this, or are we just 400 small organization with 5 people in each standing up, shaking our hands? Is there an umbrella organization that works within Canada or within North America or bigger that try to fight down these pseudoscience and homeopathics and all of it?
Yeah, I'm not aware of one particular organization within Canada. I think a lot of it is at the grassroots level. You're right. I mean, with pharmaceutical products, because of the problems with pharmaceutical products in the past, is that they have to register all their clinical trials now. So everything gets reported versus you get the cherry picking with homeopathy. I think what's good about the homeopathy is that the systematic reviews that have been done and been published in general, the best ones show that there isn't good evidence to support that. And I think it's really a question of continuing to press that point with decision makers and with other people who might accept that as a valid therapy.
Hi. You said in your talk that we have a 19th century healthcare system in the 21st century. Maybe these homeopathic and naturopathic remedies are really people's grabbing at something to meet an unmet need that they have in the current healthcare system. And if so, how can we address that?
I think that's a good question. I think that that's a good point. As I said, I think that a lot of medicine is depersonalized, and while it delivers good outcomes, doesn't necessarily cause great deal of satisfaction. And I think that is a challenge that I don't have an answer to. I think it's something that we need to, as I said, need to work at a number of different levels in terms of our dialogue with our friends and family, and as well as continuing to work at different levels in terms of calling them on when decisions start to be made around things that aren't supported by science, and holding organizations, healthcare organizations, to account. So I think that there's a lot of work that needs to be done within healthcare in terms of improving patient experience, and there's certainly a lot of things that we need to do to improve the way that we pay health professionals and the way that you access healthcare in Canada. But that doesn't mean, and I think we can look at the way that what patients and consumers are demanding and try to make sure that we're providing a responsive system. As I said, the paternalism is dead, but that doesn't mean that the way that the health professionals will work is going to change dramatically. We will still have that need for expertise, but it's really becoming more and more of a partnership. Certainly my work in my day job is within cancer therapy, and so it really is becoming a partnership where you're relying on the health professional to provide you with options and recommendations, and you're making the ultimate decisions and call in terms of weighing the risks and the benefits of, say, surgery or chemotherapy and different things, and having a good understanding of that. But so I think it's a cultural change that has to occur to a great extent.
Centre for Inquiry, Canada's premier venue for secular humanists, atheists, skeptics, and free thinkers.
This event was hosted by the Centre for Inquiry Canada, an educational charity promoting science, reason, secularism, and free inquiry. CFI Canada coordinates branches and campus groups across the country, runs a public education series, provides secular community services, incorporates cutting-edge multimedia such as blogs, podcasts, and YouTube, and is a regular voice in the press presenting a secular humanist, atheist, and skeptical perspective. Visit us at www.cficanada.ca and contact us at info@cficanada.ca.